Home care versus doctor's care. When to manage a boil at home and when to call for help. I remember the first time you notice a boil on your skin, it rarely feels like a big deal at first. Just a small, painful bump. Maybe a little red, maybe warm to the touch. You think it will go away on its own. But then it grows, and suddenly you're paying attention to it more than you want to. And that's usually where the confusion begins. Do you treat it at home, or is this something that needs a doctor? Let's talk about the simple truth. Most boils start when bacteria get trapped under the skin, usually around a hair follicle or small break in the skin. Your body reacts by sending in white blood cells, and that's what creates the swelling, the pain, and sometimes even pus. It sounds intense, but in many cases, your body can actually handle it on its own. So at home, the goal is not to fight it aggressively. It's to support your body gently. Warm compresses are your best friend here. A clean cloth soaked in warm water placed on the area for about 10 to 15 minutes, a few times a day. It sounds simple, but it helps increase blood flow and encourages the boil to drain naturally when it's ready. No squeezing, no popping. That's important, because forcing it can push the infection deeper and make things worse instead of better.
Keep the area clean. Wash your hands before and after touching the area. If it's covered, use a light, clean dressing. And try to avoid friction from tight clothing. Small things like that actually make a big difference. But here's where you need to pay closer attention. If the boil keeps getting bigger instead of improving, if the pain becomes strong and throbbing, if you start seeing redness spreading around it like it's expanding outward, that's your body telling you something more serious might be happening. Also, if you notice fever, chills, or if there are multiple boils appearing at once, that's not the time to wait it out. That's when medical care becomes important. There's also a simple rule of thumb. If you've been caring for it at home for a few days and nothing is improving, don't push it further. Sometimes the safest decision is just getting it checked. What you're really trying to do here is balance patience with awareness. Not every boil is dangerous, but not every boil should be ignored either. And if you take anything from this, let it be this simple idea. Your body often knows how to heal small things, but it also knows how to signal when it needs backup. The key is learning to listen early, not late.